4.4 billion people in the world don't have what we call safely managed sanitation. So that means basically we don't know what happens to their shit. So that's in the environment. 4.4 billion people, that's 60% of the world's population. 2.7 billion people don't have a clean, hygienic, decent toilet at home. Nearly a billion people, about just under 900 million people, have no toilet at all. So they have no choice at all but to what we call openly defecate, which is a kind of euphemistic term. Basically, go to the railway tracks, go around the back of your house, go down to the river. And what that means, if you're a rural woman living in a rural district somewhere in any country in the world, is that you have to go out, usually under cover of darkness, and relieve yourself when nobody else can see you. And the risks that women run in that context are unbelievable. There's lots and lots of evidence of the worst kind of abuses that people experience because of that. Leaving aside just the kind of sheer horrendousness of having to pick your way through fields of shit every day just to relieve yourself. Add on top of that, those are women that have nowhere safe to manage their menstrual hygiene. The problem is also perpetuated in schools, so we have girls who go to schools with no safe place to relieve themselves, or the toilets are locked, or they can't use the toilet because the boys can see, and health centres. So I can't quite remember the numbers because we don't have very good data, but we know for sure that about a third of health centres and health posts in Africa, for example, have no decent sanitation facilities. So imagine being a woman in labour, turning up at a health post to deliver a baby, in a room where somebody has already just delivered a baby, but the nearest available water supply is at least half a kilometre away. Do you think that delivery room has been properly cleaned in between? No. And your partner comes with you, your little children are there, and there's no safe toilet. So, the big numbers are horrendous, the human stories are also horrendous. One of the tragedies, I would say, in public policy everywhere, I'm not saying this is just a developing country issue, but it's almost that the safest thing is to do nothing. As long as you do what's always been done, you're kind of okay. You're not rocking the boat, you're just carrying. It doesn't matter if it never works. If you're just applying the rules, you're safe. And what we really need is to try and create an environment where people are willing to say that's not working, and then try and innovate and make things work better. So there is a universe of people out there, I think of them as young people, but young is a relative term, but there are people all over the world who know they want the space to change what they do, and they really are constrained because it costs a lot of money to take yourself out of your environment and bring yourself into this intellectual space where you can work. Every single student who gets a scholarship and comes to us, the scholarship opens the door to that intellectual space where these people can grow and develop and imagine a different future. And without it, they couldn't do that. Travel bursaries also have a really significant effect. So once a student is here, and they kind of you open the door and you see, how suddenly they're aware of the bigger world and the bigger ideas and how their experience fits in a body of sort of intellectual knowledge, if you like, and practical knowledge. Then they want to go and apply that out in the field. And so the bursaries enable students to do one of two things. One is to go back to their own place, but in the guise of a researcher and see something from a different angle, or it enables them to go to another place to apply what they know in a different context. And for many of these students, that might be the only opportunity for them to work in a different environment. So it's really game-changing for those students. Almost exclusively, they couldn't do it without the bursary funds. These people have they've scraped together every last penny to get here, and then to try and get away again to do field work, it's almost impossible. My ideal vision is that some or all of my students become sufficiently powerful in the end, they become the chief engineers, or they become the chief secretary, or they become the minister, and they can put their hand over their professional group of people trying to do WASH development and say, now we're actually going to try and solve the problem, not just roll out the same old programme forever and ever. The problem with sanitation, I feel, is that people who are in wealthy places, us, but also the elites in all these countries where we work, they cannot imagine really that people live like that. If you don't live it, you can't imagine it. It's so exhausting and debilitating, and it's not fixable by people, the whole sort of myth of, just pull your socks up and get on with it. People can't do it on their own. It needs an institutional response. And so we need to equip public servants and people in NGOs and people in the private sector who can really solve that problem.